Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the non-operative treatment of adult scoliosis. What exactly is adult scoliosis? Well, it involves rotation and curvature of the spine due to degeneration. So it's very different than pediatric scoliosis, which is also known as adolescent idiopathic scoliosis. And the reason is that the difference is that it's often painful, whereas pediatric scoliosis is typically not, or minimally. It's very stiff, therefore it's not responsive to bracing like you have in the pediatric situation. And it often leads to both back and leg pain, whereas pediatrics has some incidence of back pain, but rarely do you have any leg pain. Why do adults get scoliosis? Well, it occurs for one of two reasons or a combination. First reason it may occur is simply an exacerbation of pediatric scoliosis. For example, if you have scoliosis as a youngster and you don't need surgery for it, but your curve is right at 40 degrees or higher when you become skeletally mature, studies show that on average it will get worse at about 1 degree per year on average. That doesn't sound like a lot, right? But if you're 20 and then you have a curve of 40 degrees and then it gets worse at 1 degree per year, by the time you're 70, you're talking about 50 more degrees. So that's about 90 degrees. So it really does add up over the years. The second reason that adult scoliosis can occur is what's called de novo. It can occur new due to spinal degeneration. It doesn't matter if you had no scoliosis as a kid. It can get worse through just arthritis and spinal degeneration. First thing that happens is the disc itself starts to degenerate. Then that leads to abnormal motion in the facet joints in the back of the spine and asymmetric arthritis, and then that can lead to nerves getting pinched and what's called spinal stenosis. So here's a picture of what can happen. Okay, the disc spaces themselves start to degenerate. Then you get the abnormal motion with the facet arthritis. Then you get asymmetric degeneration. And these nerve roots, as they come out from the areas where I'm pointing here, start to get pinched. So you get back pain and you get leg pain. Okay. You also may see muscle weakness and aching, difficulty standing up straight, and then the buttock and leg pain from the spinal stenosis. So what are the treatments for adult scoliosis? Well, it should be known first up front that this is a quality of life decision. It does not have to have surgery. It would be elective if you go that route. It may be that you just causes some moderate pain, and over-the-counter medications like Advil or Tylenol may help when that happens. Now, for those periods when the pain is significantly worse, you may want to take higher strength nonsteroidal anti-inflammatories. Narcotic medication can be okay for short-term pain relief. For long-term pain relief, typically narcotics, the risks start to outweigh the benefits. In addition, neuropathic pain medications such as Lyrica or Neurontin can be very helpful for the nerve pinching pain from the spinal stenosis. Topical pain medications, there are anti-inflammatories. There's also lidocaine patches. The anti-inflammatories come as gels or creams, so those can be helpful. Physical therapy can help strengthen up the muscles around the spine, help take some pressure off of it and relieve pain. And then there are interventional treatments. The interventional treatments for adult scoliosis are quite a few. The picture that you see here involves a facet joint injection. Okay, this is where the arthritis occurs and a lot of pain can result. So injecting cortisone into this joint can help with pain relief for weeks to months. Okay, trigger point injections, which are a very tiny needle going into the muscle areas around the back, can help a lot if there are spasms. Additional interventional treatments, one that you see here in the first picture is called a medial branch block. These tiny little nerve endings supply sensation to the arthritic joints. So with numbing medicine and possibly steroid, you can numb this area, and that provides pain relief on average, studies show, for 3 months. Okay, so and if then when it wears off, you can either repeat the medial branch block or go on to what you see down here, which is called a radio frequency ablation. And this is a coil that comes down and supplies thermal energy and heat to the area and then kind of deadens these medial branch nerve endings. And that can provide pain relief for 12 to 18 months. And then it can be repeated if necessary. Okay? An additional procedure that can be very helpful is epidural injections, and this is placing steroid medication around the area of nerve pinching. So that can work well for spinal stenosis. It may need to be done as a series of injections, a series of 3 over a period of 6 weeks, and then that can be repeated every few months. So what are the outcomes with non-operative treatment? Well, over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without needing surgery. Okay? Between the treatments for the back pain and the leg pain, most patients end up getting a baseline level of pain that just is okay. Now, you have to keep in mind that surgery is elective and quality of life decision, and it should definitely be a last resort. The surgery involves both a nerve decompression and a long fusion, and it has a very high complication rate, over 50%. So here's a typical adult case. You can see that this person had a 70-degree curve, very painful, also had some spinal stenosis, so aching in the buttocks and thighs, legs, and then they ended up having a decompression and a very long fusion. That's a lot of hardware. Okay, there's also hardware in between multiple disc spaces. This is a surgery that usually takes 2 days. They stage it, and it's a long rehab, 6 to 12 months. Okay, and adults just don't tolerate these long surgeries like you do when you're a child. The top pain clinics in Arizona is at Arizona Pain Specialist. They offer comprehensive pain management, all the treatments that we just discussed. There are 5 locations that accept over 50 insurances. The pain doctors are board certified, award-winning. They've won the Patient's Choice Award for 5 years in a row. The phone number to call for scheduling is 602-507-6550. And the website to visit is ArizonaPainNetwork.com. Thank you for listening. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.